Jason. Thanks y'all for joining. You absolutely do not have to have your video on, but if you want to have your video on, I always love to see faces. But I will kind of go over what we're doing today. I'll introduce myself a little bit more, and then you can kind of have a lay of the land. We will have a decent amount of engagement, but it's primarily through the chat. But if you do have questions or want to speak out loud, this group is small enough that I'm very happy to kind of engage in that way as well. So feel free to raise your hand if you want to unmute, or and if you have any questions, feel free to throw them in the chat and we'll address them as they come, or if they're longer answers, then we'll do them at the end. Thank you again for your time, and thanks so much to Anid and Jason for inviting me. I'm going to share my screen and we'll get started. So we are talking about Weight Stigma 101, the basics on weight-based oppression and how we can show up. Weight stigma is a really complicated and big topic, and so I pull the most basic information to get an overview of the topic. But there at the end, there will be kind of a list of things that we didn't get to, things that you can look up on your own. There are lots of resources out there, lots of Instagram pages, and I'm gonna have a resource guide that I can send along to Jason, who can send it to our registrants, as well as the slides and all of the sources for the statistics and things that I present. So today we're talking, I'm going to introduce myself. We're going to go through a few community guidelines just because this is an engagement discussion, and I want to make sure that we're all on the same page. We're going to do a little bit of a fun, I don't know if it's fun, but a little word cloud of words related to a topic. And then we'll do some basics on intro to weight stigma. What is it? Who is impacted? And then getting informed, giving you some statistics on kind of things that I pull out of my back pocket when I'm talking about this topic. They're shocking and they're real, and I have also updated them to reflect some research from the 2020s to make sure there is a decent amount of modernity to the statistics. And then we'll talk about how weight stigma can and does show up in eating disorder spaces, and then further reading and resources, as well as things that we didn't have a chance to talk about because it's such a big topic. So my name is Serena Nangia. I use she, her pronouns, and I'm based in Colorado Springs. I'm using the Anid peer support group model of the name, pronouns, and where I am. And I am an Anid support group leader for the People in Larger Bodies group. We have another group leader here, Silpa, and it's such a phenomenal group. I'm really enjoyed working with the folks in that group to kind of address some of the unique ways that eating disorders and weight stigma show up as we're in recovery. I myself am in recovery from an eating disorder, more recently discovered and more recently addressed than I ever thought. I always identified as someone who had and do have a sister who had an eating disorder. She's in long-term recovery, but that was my story for a long time. And then I realized through weight stigma and racism and a lot of other factors that I didn't know that I had an eating disorder as well. And that's one of the things about weight stigma, is that it can prevent people from knowing that they have an eating disorder, especially people in larger bodies, but it can affect everyone. I'm also a person who focuses on marketing communications within the eating disorder and mental health space. And what that means is that I am very intentional and work on messaging around these topics. So a lot of us know in the field that there is a very nuanced conversation, especially around things like weight stigma and eating disorders. And I've had the privilege to be involved with some some cool organizations doing that. My company that I'm doing this through is the Body Activists. The Body Activist mission and my mission as a person is to encourage conversations around bodies, educate about the risks of stigma and negative body image, promote leadership, and pursue action, specifically through elevating underrepresented voices and challenging the status quo. And what this means for me is specifically uplifting people of color, people in larger bodies, queer folks, trans folks specifically, and challenging the status quo means doing things differently than they have been done before, or not being afraid, or being afraid and doing it anyways, to call out and call in folks and organizations for to continue these conversations and dialogue and make positive change. The community guidelines I go in with these discussions, I first of all like to use I statements when discussing my experiences, and I hope that you will with your experiences as well. Something that comes up often is, you know how we all feel, you know how it is, and while a lot of us might feel similarly about certain things, it's not necessarily true. Someone might experience a specific trigger that feels really bad, and the same thing might happen to someone and it feels good. So using I statements when discussing your experiences. As I'm reading this, feel free to share in the chat where your name, your pronouns, where you're tuning in from. I forgot to mention that at the beginning. I'd love to kind of know a little bit more about you. Anything you want to learn here that you can think about now or type later. Okay, community guidelines continued. So we don't use numbers, specifically weight and calories, and recognize that everyone here is at a different place in their own recovery or journey with food and body. And specifically, I put these words on there to not use the words overweight and obese. This is the only time that I'm going to be using these words specifically, unless I absolutely have to. The reason a lot of people in the fat community don't use the word overweight or obese, but instead prefer to use the term fat or people in larger bodies, is because the terms overweight and obese are pathologizing, meaning they put meaning and see fatness and body size as a disease, which is not something I agree with. It is a descriptor. Fatness is a descriptor for me. It also represents some of the things I experience as someone with that marginalization. But overweight and obese are specifically words used with BMI, as well as at the doctor's office, that are very harmful. So I try not to use them. Within the space of weight stigma, we use the term like the O words if we're referring to them. And number 4 is basic. We're all adults or people who have chosen to be here. So choosing to be respectful of each other is super important. So we're going to get into this part of the session. I want to read a few of the chats. Thank you all for being here. Shannon's here from Florida. Anik is from Montreal, Quebec. Ellie Kate is from Louisville. Isabel from Chicago, Illinois. And Silva from Pennsylvania. And Rhiannon from Minnesota. Vera Kate from Michigan. Cool. Thanks so much for being here. So if you either want to scan this QR code, or I'm going to put this in the chat. We're going to do, what words do you associate with the word fat? And what words do you associate with fat people? Now, because you have all chosen to be here, you might not have the same preconceptions that a lot of people do. So what I also ask you to do is, what do other people think or say about fat people? And we can just go from there. So I'm going to share this. I want to, let's see, present. Can you still see it, Jason? Yeah, okay, perfect. So someone shared, you can submit multiple times if you want to. Someone shared vulnerability, stigma, pain, discrimination, otherness. I would love everyone to think about like what other people think of when you see someone. If you're sitting with someone, you see someone who's fat, do people make comments? That sort of thing. Someone said lazy. Absolutely. People think of fat people in larger bodies as lazy. Someone said unhealthy, triggering. So can trigger someone's own beliefs about their body image, as well as what they think about other people in general. Disgust, definitely comes up. Control, laziness again, eating. There's a lot of conversation around fat people and eating. Of course, there's a lot of conversation around eating in general with diet culture, but it definitely shows up specifically in weight stigma. Someone said inferior, a lack of control, laying up some shame. Yeah, watched. That's an interesting one. Uncontrolled. So the biggest ones people who have said that came up are eating and a lack of control, or lack of control when eating, right? If we did this conversation with a larger group and with people who didn't choose to come to a weight stigma conversation, it would be probably a lot more disrespectful. But I wanted you all to share that, so thank you so much for taking the time to do that. This is just kind of to get us in a point where we're thinking about how people view fatness and how we ourselves view fatness as well. So now I'm going to do a little bit of an intro to weight stigma, just get the basics about what weight stigma is. If you have any questions, or if you want to pause, or if you have things you want to bring up, please send it in the chat or raise your with the Zoom feature. Okay, so weight stigma, this is my definition. There are a lot of different definitions. My definition of weight stigma is the implicit, which means direct, or sorry, not direct. So something that happens subconsciously potentially, and explicit, something that happens directly, that people can track that they did intentionally. The implicit and explicit bias and oppression of fat individuals, which is intrinsically linked to anti-Blackness, racism, classism, misogyny, and many other systems of oppression. What's really cool about weight stigma, not as a thing that exists, but as a topic of research and conversation, something I'm very passionate about, is that it really overlaps with every single part of oppression and discrimination. And that is something that we're not going to get into too much because it's so big and vast. But that is something that I'm really passionate about sharing. Specifically when it comes to anti-Blackness, there's a lot of discussion around, I'll show some resources at the end, but there's a research around how the idea of anti-fatness came from anti-Blackness. And I can give some more information on that at the end if we want to dive in a little deeper. So this might seem like a really random question, or like obvious. Who is a fat person? The reason that I do this is because who is primarily impacted by weight stigma? Everybody is impacted by weight stigma. not only because you have friends who are fat or you yourself are fat, or like you might have a kid who's fat or anything like that. It's because fatness, anti-fatness and weight stigma are perpetuated and totally ingrained in society and culture. So we can think about it in similar ways to racism. If you know anything about racism and how it is systemic, you'll know that, of course, people are harass people and bully people through explicit bias, in the similar way that people harass and bully fat people. But it's also implicit, so it's integrated into systems, meaning I'll give you some examples in a second. So who is a fat person? I define a fat person as someone who, first of all, potentially someone who identifies as fat. That's complicated because some people might, we've, in the eating disorder world, we talk about people who quote unquote feel fat. That is different than someone who is actually fat. And there's a whole conversation around if fat is a feeling, and we're not going to talk about that today. But a fat person is someone who identifies as fat and or someone who is affected by systemic issues of fat phobia, weight stigma that decrease access to things. Specifically, access is a word I want you to remember. Access to things such as adequate medical care or health care, clothing at stores, seating options, and job hiring / promotion / firing. This is the most basic way I could give of what a fat person is and who is most impacted by weight stigma. Something that we're not going to talk about today that you can look into, I'll show you the list at the end, is a fat spectrum. So there are people who are smaller fat who have more access. There are people who are larger fat people who have less access. And then there are straight size people who are the opposite of plus size people, or thin people who have access to all of these things, even if other parts of their identities create a lack of access or decreased access. As you can see, it's a very complicated topic. So I found this study actually this week talking about the contributors and consequences of weight stigma. They use a different word to describe this, but if you take a look at this, and I'll send this along with the materials, we can take a look at formal media, how weight stigma shows up in journalism, in the news, and in advertising. It shows up in the entertainment industry. I don't know why social media is under entertainment industry, but I guess it can count there. Social media is its whole thing. So weight stigma shows up in social media, film and television, and literature. Social weight stigma shows up in the food industry and the influence of that food industry, policy and legislation, and public health campaigns. We've seen this through the war on obesity, as some people would call it, or the obesity epidemic. It is related to unequal education and employment, social rejection and discrimination, exclusion from public spaces. This one you can take a look at if you want to later, but it's not relevant to this conversation. Chronic allostatic overload, so the impact on our bodies or people's bodies when they experience weight stigma, and then worse healthcare. And then the psychological impact, meaning reduced quality of life, meaning experiencing discrimination and having to struggle with that. And then poor mental health outcomes, which can relate to eating disorders. Allostatic means, my understanding of allostatic is that it means physical overload. So you're experiencing a chronic physical response to weight stigma, meaning like if someone experienced weight stigma, they might have, and this is really interesting, like higher blood pressure, more activated nervous system, meaning higher cortisol levels, impact on blood sugar, and like the way that our bodies show up are impacted by negative experiences, and specifically when it's not just personal one-on-one, but it's also created by the system. It's a nervous system response. It's basically like, if you've heard of minority stress model, it's how discrimination impacts our physical bodies, which it does. Thanks for those questions, Shannon. So, this is my favorite part of the session. It's a little depressing because statistics are critical for our understanding of how big a problem is, but it's also like hard because it can feel daunting to deal with it. Rhiannon, let's, Jason, will you flag that question about the word fat? I would love to talk about that at the end.
Yeah, absolutely.
Thanks. Cool. Okay, so let's get into stats. For the purpose of this conversation for now, fatness and the word fat to me is not derogatory, and I will explain more about that at the end. So at least 13% of people in the US report experiencing discrimination based on body weight. This is from 2017. This is pre-Ozempic and GLP-1 blow up. That's a lot of people in the US. The prevalence of weight discrimination in the US increased from 7% to 12% of the whole population between 1995 and 2006. This type of research is self-reported, so there are questions around that way of studying things, but that's the only way we can, one of the only ways that we can get this sort of information. But the statistic that a lot of people talk about is that there's been a 66% increase in the last decade of weight discrimination. The statistics do line up. I checked. Both of these statistics are directly connected. There's a plus or minus 5% leeway based on the research, but a lot of people experienced weight discrimination, and it's increasing is the overall. Within healthcare, a meta-analysis of 41 studies, so a study that studied 41 studies, found that healthcare providers hold significant implicit and explicit anti-fat bias. We know this with lived experience and understanding of that, but we now have more research to show that. One that really shocks me every time I read it is that 90% of emergency rooms are lacking basic equipment like scanners that can accommodate people in larger bodies. My friend Ivy Felicia put together some of these statistics, so I always thank her for that. What this means is that only 10% of emergency rooms have scanners in case of emergencies where someone, a larger person, a larger body, gets shot or has some other crisis that they need to have a scanner from. They are to figure out what's going on. They are less likely to get access to that, or it's going to take a lot longer because they need to find a scanner from a different part of the hospital or take them to a different part of the hospital, meaning that fat people or people in larger bodies are more likely to die in emergency rooms. This is particularly a scary one, something that I try not to think about as a person in a larger body, but it also depends, once again, on how big of a larger body you are in. So if someone is in a smaller to mid-fat body, I'm likely to have access to scanners, but someone much larger than me doesn't, and that's why access is related to discrimination and weight stigma. People in larger bodies than me are more likely to die in an emergency room. The majority of doctors' visits for patients in larger bodies are recorded as lasting a shorter length of time than visits from folks in thinner bodies for the exact same ailment. 81% of dietetic students report having prejudices against people in larger bodies. If you've ever worked with a dietitian who is not informed about weight stigma, or you've gone to school for dietetics, or if you've taken any sort of course on this, it's pretty obvious how this shows up. And a large reason is because of the way that the education is structured, talking about the epidemics that they see and that focusing on making people smaller, addressing body size rather than symptoms. So when I think about why potentially doctors' visits for patients in larger bodies are shorter, is because in my experience and experience of a lot of other fat people, they come in for a sore throat, or they come in because they have a skin condition, or something that you wouldn't think would be related to weight, and the automatic response, the automatic and often only response, is to lose weight. Rather than treating the sore throat, rather than treating the skin condition, the thing is you need to lose weight and come back in 3 months and we'll see how it goes. If this is not something you experience, I'm really glad for you. A lot of women or people in gender diverse bodies experience this also. Yes, anytime you go in for, Rhiannon said same shit with anytime you go in for an eating disorder. Doctors don't understand eating disorders. It's very similar to how doctors don't understand weight stigma, but weight stigma is even more deeply ingrained into the healthcare system. I mean, it's not helpful to compare them because I think both eating disorders and weight stigma are not addressed fully, appropriately, or even at all in most healthcare programs and education. Speaking of education, teachers report that they have lower expectations for fat students in comparison to thinner students. You can imagine how that might impact fat students who are trying their best, fat students who are asking for help in classes, that sort of thing. Doesn't mean all teachers, but some teachers do report that. People in larger bodies are consistently granted fewer promotions and raises. Specifically, a study from 2004, this is a very old study, so it means that people in larger bodies with the exact same qualifications as a thinner person make $1.25 less per hour. Over a 40-year career, this means $100,000 less. And that's based on money numbers from 2004. So maybe next time I'll adjust for inflation. Additionally, and this is a more recent study from 2018, a review of over 1,400 studies found that people in larger bodies are less likely to hold decision-making or leadership roles than their quote-unquote normal weight peers. This can be for a number of reasons, but if you want to kind of understand one of the reasons, it could be because fat people might be trusted less, or that they're seen as lazy, so they don't deserve a decision-making position. This can be super subconscious. So someone might not know that they're making a decision based on weight stigma or a number of other factors, but it absolutely shows up. Again, if you want to look at the research, I'll send along the research for every single statistic that this is from. I added these two because I wanted to talk about media. 70% of people in higher weight bodies featured in news images were depicted in a stigmatizing manner. This might be, a stigmatizing manner can be kind of vague. So I will offer another statistic in a second, but this is not surprising if you know if you've noticed how people in larger bodies are depicted in media, meaning like the news and TV, this would not be surprising. Jason, I'll answer that question also at the end. Thanks, Shannon. Okay. And then so I found a more specific answer for stigmatizing within a different study. Higher weight individuals are more likely to be depicted without their heads in news media rather than lower weight individuals. And this is called the headless torso phenomenon. Essentially, it's reducing someone's humanity and using just their bodies to put a lot of the notions, societal notions that we have onto this topic. Sorry, I got distracted. A lot of the societal notions like the laziness, the lack of control, all of those things are easier to put on someone in a larger body if you can't see their head because they're not human or they're not personal. It's not personal. It's less personal. So that is one example of how media stigmatizes folks. This part is really critical, and it's essentially, we can't get into too deep of it, but systems of oppression compound. What this means is that if you're in a larger body, you of course experience weight stigma. But if you're in a larger body and Black, you will experience more stigma. If you are in a larger body and you're Black and you're a woman, you'll experience even more stigma. If you're in a larger body and you're Black and you're a woman and you're trans, you'll experience even more stigma. So all of that goes on top of each other to create more and more issues to access, like healthcare, education, representation in media, and jobs. But it also means that people who have only one marginalization still, of course, experience marginalization, but it's just less marginalization, meaning that their access to all of those things I mentioned is increased. It's more than someone who has a lot of marginalizations. This is just the way that the system works. It is intentionally works to oppress the oppressed more and more. But there is hope, of course, because a lot of places are doing important work, and we're talking about this conversation to make it known and not just beneath the surface. So I wouldn't lose hope, but it's helpful. It's been helpful for me to know that how my marginalizations interplay with other marginalizations and privileges that I have. So I interact with people knowing that information. Before we move on, let me answer a couple of those questions, I think. And I'm gonna, do you want to go?
Yeah, do you want me to pull them up or?
I think actually, because there hasn't been too much chat, I can see it. So
okay, cool.
Thanks, Jason. Rhiannon, I want to address your question first, which was, doesn't fat feel like a derogatory term? To some people, it does feel like a derogatory term. When I was growing up, fat felt like a derogatory term. For me now, using the word fat is a reclamation of a word that has been used against me and my community, people in larger bodies. So rather than seeing it as derogatory, I use it because it's just a description of a body. It's a description of my body, and I do not want to let other people use that word to hurt me as much. So using it commonly and using it as an empowering word as well to find community means that it's less powerful in negative and derogatory circumstances. If someone calls me fat online, which they do, I'm like, yeah, I am. So I've been able to take the negative or some of the negative out of it. And that is not true of everybody. People in the fat community or people in larger bodies have many different opinions about this. Shannon.
Hi, Serena. Thank you so much for this discussion and giving of your time. I have a question about, could you give specific examples of how you have reclaimed fat to be a positive rather than a negative? Because my nuclear family was bullied by using the word fat.
Yeah. So I can give you examples and ways that I've done it myself. But the reality is that the words that hurt me more personally were the O words. So I would prefer to use the word fat because it's hurt me a lot less than the O words. Your family might absolutely never want to use the word fat. It's only derogatory, or you may feel that way, and that is 100% okay. We get to choose the language that we use to describe our bodies, and if our community or our family have made like, don't call me fat, then that's okay. You don't call someone fat, right? It's a really great question, actually. I haven't pondered it in a second because I've been lucky enough to feel this way for a while. I think I started with it just being a descriptor as a neutral term. And what that meant was it was a reframe inside my brain, right? Like using different therapeutic ways. So like reframing was one thing. If someone calls me fat, I look in the mirror and I am in a larger body than a lot of people. We live in America where over 66% of people are in larger bodies. So that's another topic to talk about, but I'm okay using that term. I started with being like, okay, I am fat. What feelings does that bring up? Pulling apart what fatness means and finding that fatness doesn't mean laziness. Like redefining what fatness meant for me. Fatness doesn't mean lack of control. Fatness doesn't mean that I'm unable to get work done, that I can't exercise, that I don't exercise. I find places in my life where that fatness doesn't mean that. I might be lazy. I am lazy a lot of the time, but that's not because of my fatness. I'm not lazy automatically because I'm fat. I'm not lazy all the time. It's wild to assume that one type of person is one thing all the time and that homogeneity is like possible. I think also taking stock of like how my thin friends acted and how they weren't being judged for that. Like they're lazy. They don't exercise. That doesn't mean that all thin people feel that way. So I think it takes a really long time and it depends on if it matters to you to use that word. You absolutely don't have to. It's completely up to you. You know, it's everybody's journey with deconstructing systemic and interpersonal discrimination is different.
Thanks. I was just trying to basically get sorry, TBI, like a roadmap to start my journey on fat reclamation. That's all. Thank you.
Yeah, absolutely. And I wonder, I'm gonna think about maybe doing another presentation, maybe with Anna, maybe not, depending on what Jason wants, about like maybe for
You do it
specifically
with
for
us.
people. Specifically for people in larger bodies, yeah, I'll do it with Anna. Because it's a whole different thing being an ally to someone who is in a larger body versus being in a larger body yourself. And I teach a course on a workshop on how to be an ally to fat people, which is specifically for people who aren't fat. And that's another thing. So Jules has an interesting point in how the word fat, how they dealt with the word fat too. So that would be interesting to read. And interestingly, the difference between fatness and larger body in women versus men. We know gender is diverse, but people, let's say people who are perceived as women versus people who are perceived as men, is very different. I would say larger bodied in men is sometimes considered muscular, and that's not what I'm referring to. However, BMI doesn't care if you're muscular or not. So they do, people who are super muscular might experience some level of weight stigma, absolutely, because of BMI would put them under the O word range. But when I'm talking about fat or larger bodied, it usually means someone who, like, if you think about a fat person or someone who is in a larger body, it's probably what that is.
A higher percentage of body fat?
Yeah, if that's a helpful, I would definitely agree with that. I think when I refer to fatness and like why I defined what a fat person was at the beginning is because it's someone who experiences access issues. So someone in an ultra muscular, very large and tall body, but doesn't have fat, might not be considered fat, but they do struggle with access to clothing and seating and fitting in an airplane. So that's how I consider access. Like, just think about access. Does this person feel that? But obviously, we know that people who have muscle versus people who have a higher body fat are perceived differently in society.
That question came up for me during the slide that you had about fat or larger body people don't have leadership roles. And I've seen many men have leadership roles. So I'm wondering if it's perhaps not as much a larger bodied issue as it is a gender issue.
It's definitely intersecting. Absolutely. And I think it depends. That's a great point. This is just the research that exists right now. It's just one part of research. I absolutely believe that sexism and gender has people who are women who are in or who are trans who are in larger bodies experience this more often than men. But I do also know larger men who, my dad was overlooked for, he works in healthcare and he's in a larger body and he's brown and like a lot of other things, but he was overlooked for a position that he was more qualified for than the person who got it, who was in a smaller body. And I absolutely believe that him being in a larger body played a role in that because they are in the healthcare space and optics means something to healthcare systems. It doesn't mean it's right and it's really fucked up, but I do think that played a role. So that's kind of, it doesn't mean it's true in all circumstances. It just means it is true in some circumstances.
Okay, thank you.
Thanks, Shannon. I really appreciate the questions because I don't want to be lecturing at you. This is more of a lecture than I normally do because I wanted to get as much information across as possible. But please engage with me. I'll give you my information at the end and I want you to, like, we can always, any of you, we can hop on a call. Okay. We are running out of time, so I'm going to do this part because I think this is talked about a little bit more often than even the basics of weight stigma. Weight stigma shows up in eating disorders in the eating disorder space all the time. One of the examples is that we know that less than 6% of people with eating disorders are medically underweight, meaning that 94% are normal or higher weight people. People who are struggling might not think that their eating disorder is serious if they're in a larger body. I didn't think, like, my own experiences show that. Even though I knew about this statistic, I didn't take my own eating disorder seriously. These ones are always shocking to me. Young girls are, and we'll talk about like people who are socialized as girls, are more afraid of becoming fat than they are of nuclear war, cancer, or losing their parents. And the British Journal of Psychology found that 50% of 3 to 6-year-olds say they worry about being fat. By the age of 7, 70% of girls want to be thinner. By the age of 9, 50% have already been on a diet. And girls aged between 11 and 17 say it's their number one wish in life to be smaller. We know that the impact of this is that people who seek control of their body size, specifically children, and who are developmentally young, and they're developing their brain, it becomes the focus of their lives. And we know that dieting, these are other statistics, but we know that dieting and this mentality of like focusing on being smaller leads to more eating disorders. If you yourself have experienced an eating disorder, or you know people who have, or you just understand the impact of eating disorders, you know how horrible this is. Something I'm looking forward to doing in the next few months is helping an organization called Be Real that focuses on helping young people learn about taking care of their bodies in a way that's not promoting eating disorders or dieting. High weight people with eating disorders are exponentially more likely to be encouraged to engage in eating disorder behaviors, such as restriction or overexercise, in order to lose weight, and then they are to be screened for an eating disorder by their doctors. People in higher weight bodies are told to lose weight by any means necessary. We've seen this show up in the use of GLP-1s, where there is research on how it helps people who have diabetes or who are pre-diabetic, if they do not have a history or an active eating disorder. People with eating disorders should not be on GLP-1s, and doctors know that. That's another conversation for another day. But people in larger bodies are told to lose weight by any means necessary. And that often means creating or engaging in an eating disorder or disordered eating behaviors. They're likely to be pushed into the eating disorder literally by health practitioners or their family. I was my health practitioner, my pediatrician, when I was 10 years old, recommended that I get put on Weight Watchers. Luckily, my mom was a nurse and knew that that was really messed up and didn't let them do that, and she didn't do that with me. But Weight Watchers is a diet, so that when you're so young, it really is, you're more likely to experience an eating disorder because of it. It really messes up your relationship with food and body. And people in larger bodies are also told implicitly by societal expectations whether they're seeking acceptance or better living conditions, meaning that people in smaller bodies are often treated better by society and by individuals. So in some ways, it can be understandable that someone wants to be in a smaller body because they want to be treated better. How I have interacted with that understanding is that I choose not to surround myself with people who make me feel that way. And my living conditions are better than some thinner people that I know, because I choose not to surround myself with hate and discrimination as much as possible. And there are only some things that I can control. This one I added, people in larger bodies are presumed to have binge eating disorder rather than any other type of eating disorder. I myself was diagnosed with OSFED, but specifically, I only experience restriction. I don't experience binging. And I found that as I shared my story, even recently, I've had people like, oh, you're focusing on like controlling your food now, huh? I'm like, no, I'm focusing on eating more. And this is really reductive because people in larger bodies are less likely to find help if they have a restrictive eating disorder, but it also, binge eating disorder has a very important restrictive aspect to it, meaning that it's often in response to restriction. And we don't talk about that. Binge eating disorder is seen by society as the fat person eating disorder, which is obviously weight stigma. Feel free to add in the chat any other forms of weight stigma that you've noticed or experienced in eating disorder spaces, or just in general if you want to share. There's a lot more, and I literally just scratched the very surface of that iceberg. So if you want to share in the chat, then I would love that. As we finish up, some of the things that we didn't cover today are the impact, I mentioned it briefly, but the impact of GLP-1s and Ozempic with weight stigma, health at every size, which is a framework that some people use to counteract weight stigma. And I have taught about that before as well. Skinny shaming versus weight stigma. There's a really big difference. I could go into deeper detail if we had time, but maybe another time. And then the fat spectrum, I mentioned this, but small fat versus super fat versus large fat versus medium fat. There's a whole spectrum related to access. Size equity legislation. So the National Association for Advancing Fat Acceptance, NAFA, is working on size legislation within states and cities. I specifically am working on hopefully introducing a size equity bill in the Colorado state legislature. Everything is really slow right now and they're not responding to me. So we'll see if we can introduce it in 2026. But what this means is preventing people from being fired or looked over for a promotion based on body size. Right now, that's completely legal in all but 2 states. I believe it's Massachusetts and Michigan that have that legislation. And then New York City passed it a few years ago. And then weight stigma specifically within children and teens. We didn't talk too much about that. The minority stress model, we didn't really go into that. That's a really interesting thing. Like we talked about how discrimination impacts our physicality and our physical health as well as our mental health. And then bias in research and science. And then topics to dive deeper into that we did mention. We mentioned the deep relationship between racism and weight stigma. It is far deeper than we talked about today. Media representation and social media, that has a huge impact on weight stigma. And then the impact of weight bias in both healthcare and workplaces, which we talked about we did a little overview, but all goes much deeper. And then here are some further education resources. There are so many more. This is just the tip of the iceberg again. So you can take a picture or get this in your inbox later. But this is one place to start. And I'm going to read, because Jules shared that they have seen way too many people discharged from treatment prematurely due to being in a larger body, specifically because the DSM-5 in its current iteration does not recognize anorexia in larger body individuals. So insurance cuts people. This is one of my biggest issues with the DSM. It does not take into account the severity of behaviors or any negative physical or mental outcomes, and instead only focuses on the weight, which is incredibly problematic and results in people relapsing and not being able to access treatment altogether. I'll include this, but Colorado passed a law, I was a part of it, that prevented insurance companies from discriminating based on BMI related to insurance authorization, which it was a really big win. I'm not sure how effectively it's been implemented, but that's something we're definitely addressing. Thank you so much, Jules.